somewhere between $5,800 and $6,300 a month. That is the honest answer to what assisted living costs in America right now. And I want to be upfront that it is a range rather than a number, because the three big surveys do not agree with each other. $60,000 to $75,000 a year, give or take. That is what the median looks like at the time of recording. But here is the thing nobody tells you about that number. Almost nobody actually pays it. Not because it is wrong, because it is a base price. And the bill has at least three other things stacked on top of it. And by the time you have added them, two people in the same building in identical apartments can be paying thousands of dollars a month apart. So let me give you the real number first, then the four things that move it, and then who actually pays for all this, because that last part is where most people are working from completely wrong information. Start with where the figure comes from, because you will see different numbers everywhere, and it is worth knowing why. SeniorLiving.org puts the median at $6,313 a month as of June this year. That is $75,700 a year. CareScout, which used to be called Genworth, puts it at $5,900, $70,800 a year. Their survey polled nearly 5,000 licensed assisted living communities across every state, and it is the one most other figures are built on. Their last edition was up about 10% on the one before. A Place for Mom lands at $5,830, so they disagree by about $500 a month. Different samples, different room types, some measuring median and some average, all taken at different points in the year. That is why I gave you a range instead of pretending to a precision that does not exist. Now, the four things that move it. Number one, and this is the big one, levels of care. That median figure is a base monthly fee. It typically covers the apartment, meals, housekeeping, and some personal care support. But most communities price actual care in tiers. When somebody moves in, they are assessed, and that assessment puts them on a level. Someone who just needs meals and a bit of supervision sits at the bottom. Someone who needs help dressing, bathing, and managing medication sits several tiers up and pays accordingly. And the assessment is not a one-time thing. It gets redone as needs change. Which means the bill you agree to in year one is not necessarily the bill you get in year three. So the question to ask on a tour is not what does it cost? It is three questions. What level of care are we being quoted at? What triggers a move to the next level? And how much notice do we get before the fee changes? Number two, the community fee. This is a one-off charge at move-in. It is common, it is often several $1,000s, and it is frequently non-refundable. It is also the one people are most often surprised by, because it does not appear in the monthly figure anybody quotes you. Number three, where you live. Georgia sits around $4,100 a month. The typical range there runs from about $3,800 to $5,500. Other states run far above the national median, which means the national figure I opened with is close to useless for actually planning anything. It is a headline. The number that matters to you is your state's number, and in some cases, your county's. Number four, memory care. If dementia is part of the picture, that is a different price band entirely, not a small surcharge. Secured units, higher staffing ratios, specialist training. If that is the road ahead, budget it separately rather than assuming assisted living pricing applies. So that is what it costs. Now let me talk about who pays, because this is where the wrong information does real damage. Medicare does not pay for assisted living. Not the rent, not the meals, not the personal care. The reason is that assisted living is classed as custodial long-term care rather than medical treatment, and original Medicare is built for medical treatment. Medicare will still cover medical services somebody receives while they are living there. Doctor visits, covered therapy, hospital stays. But the thing you are actually paying $6,000 a month for, it does not touch. I know that lands badly. It is better to know it now than to find out in the middle of a crisis. Medicaid is a different story, and it is more helpful than most people expect, but not in the way they expect. 46 states and the District of Columbia offer some financial help toward assisted living. Most of it comes through what are called home and community-based services waivers, and the whole point of them is to keep people out of nursing homes, which cost the system far more. Here is the part that is almost always misunderstood. The waiver covers the care, not the room and board. So it will pay for personal care assistance, medication management, health monitoring. What it does not pay for is the rent and the meals. The expectation is that the resident's own income, and for most people that means Social Security, covers that side. When somebody tells you Medicaid covers assisted living, that is what they actually mean. It is real help. It is not the whole bill. 3 more things worth knowing about the waiver route. Most waivers require you to meet a nursing home level of care need. That is a higher bar than simply needing a hand day to day. Waivers are usually capped and waitlisted. Nursing home Medicaid is an entitlement, so if you qualify, you get it. Waiver slots are limited and people wait. And the asset limit is typically around $2,000 for an individual, with income limits set state by state. For scale, the National Council on Aging puts it at nearly 1 in 5 assisted living residents relying on Medicaid for their daily care. Then there is the route people forget entirely: aid and attendance. If somebody is an eligible wartime veteran or the surviving spouse of one and needs help with daily activities, the VA can pay an increase on top of a pension. It regularly goes unclaimed simply because families do not know it exists. If there is military service anywhere in the picture, that is a phone call worth making. Beyond that, most people fund this the same 2 ways. An existing long-term care insurance policy, if there is one, and selling or renting the family home. That is not advice, it is just what actually happens. Last thing, and I think it is the most useful comparison nobody makes. Assisted living sits between home care and a nursing home on cost and on support. At low hours, bringing help into the house is cheaper, but home care is priced by the hour and assisted living is not. So there is a crossover point, and once somebody needs round-the-clock help, home care can quietly become the more expensive option of the two. If you are weighing those two against each other, work out roughly how many hours a week you are really buying, and price both. The answer flips more often than families expect. So, to put it back together, somewhere between $5,800 and $6,300 a month is the national median, and almost nobody pays exactly that. Your level of care, your community fee, your state, and whether memory care is involved will move it a long way in either direction. Medicare pays none of it. Medicaid may pay for the care but not the rent, and the VA route is the one most often left on the table. None of this is financial or medical advice, and every figure here moves year to year, so check the current number for your state before you plan around it. One thing I would like to know: if you have been through this for a parent, what surprised you most about the cost? Tell me in the comments, because I suspect for a lot of you it was something that never appeared on the brochure.